Hey everyone, this is Dr. Matthew Thacker here. I'm sorry I can't be with you all in person today, but I'm really excited to be invited back to speak as part of our neighborhood health series here at Roseman University. Today I will be not speaking about human teeth, which is what I'm usually used to talking about, but I'll be speaking about how we can take care of our pets' teeth, what methods, and what the actual current recommendations are for things like treats, toys, food, maintenance, oral hygiene. I'm really excited to speak on this topic because I love my dogs. You'll see a couple cameos of them as we go through. So without further ado, I'm going to get started and kind of introduce myself. My name is Dr. Matthew Thacker. I am the program director of our Advanced Education and General Dentistry program, as well as the clinic director for our two dental clinics here in Nevada, one in Summerlin and one in Henderson. So a little bit about me. I'm born and raised here in Las Vegas, been here my entire life. I went to UNLV for undergrad and swore I was going to get out of the city and ended up staying here for dental school. So I grew up in Henderson, live in Summerlin now, and I absolutely love being a Las Vegan. Um, I was in the Navy for 4 years, stationed with the Marine Corps for all 4 years. Had an amazing time there and made some really, really great friends, some people that I still consider close friends to this day. And so that is where I got my experience in veterinary dentistry. We served a lot of the actual working dogs in the Marine Corps and performed a lot of their dental treatment, especially out in the field when we didn't have veterinary specialists. So it was a unique opportunity, and I'm really grateful to have been able to serve. I was part of the first Marine Expeditionary Force and stationed in Twin Palms, California for a while. So. And that is my wife. I'm married to another dentist, so it's a lot of teeth talk in our house, as you can imagine. She's amazing. Her name is Dr. Angelica Jane. She practices here in Las Vegas as well, and you can kind of see our two little dogs here, little Puka and Boba on the bottom left. So you'll see some close-up photos of her and the dogs a little later. And now I'm here. After I got out of the military, I really was looking for what direction I could go that was kind of in line with what I was already doing in the military, serving those in my community, being able to practice dentistry and teach the next generation of dentists in a way that's ethical and where I can really put patients' treatment first rather than looking at a paycheck at the end of the day. So I've really enjoyed it. I've been here about almost 2 years now. Time just flies by. In that time, we've really expanded our program, starting in Henderson, and now we're up in Summerlin with additional residents. We've gone from 2,200 active patients to 7,900 active patients in just about a year and a half's time. So we're really making a big impact here in the Southern Nevada Valley, and looking forward to continue to do that. And then outside of my day-to-day job here at Roseman, I kind of have a lot of other ventures. I teach continuing education for dentists in the community. I teach dentists how to become competent in certain surgical procedures, mostly dental implants, for the Advanced Dental Implant Research and Education Center. I practice another practice in Henderson, Discover Smiles Dental, and then I also work for the Nevada Board of Dental Examiners, evaluating cases and patient complaints. And as of recently, I've been really privileged to serve our Cure for the Kids Foundation and their patients, and really see a lot of interesting dental manifestations of some pretty tragic childhood diseases. And so I know we have a follow-up doubleheader to this one, Dr. Lasky and Dr. Chen. So you guys are in for a treat for that one, and you'll hear more about that coming up shortly. Just a quick disclaimer, I am a human dentist. I'm not a veterinarian. Veterinary dentistry is a specialty of veterinary medicine. It is not a specialty of dentistry. My time in the military and my unique operational position afforded me the opportunity to really get a lot of experience in veterinary dentistry as a human dentist. The ability for human dentists to practice, veterinary dentistry is completely state dependent. Most of them require the supervision of a veterinarian at DVM. There's a lot of similarities between the anatomy of canines and felines and the anatomy of humans as it relates to the mandible and maxilla. And so as we look at these comparisons here, we'll go over a couple of the items that are interesting to note, the differences and the similarities. So for instance, if we take a look here, the maxilla, this is a canine skull, by the way. We have the maxilla, the mandible. The mandible is divided into different regions. We have the body of the mandible and the ramus. The portion of the mandible that articulates at the base of the skull is the condylar process, and then we have our coronoid process, which a big fan-like muscle called the temporalis actually inserts into. We have a zygoma, which is your cheekbone essentially, and then the exit of the nerve from the jaw through the mental foramen. So you can kind of see some of the similarities, kind of interesting, kind of the development and the evolution of other mammals in comparison to humans. So when we actually look at our tooth anatomy and the jaw anatomy, this is where we have a lot of differences, okay? So if you look to the left, we have the feline maxilla and mandible, and the canine and human. So humans generally have 3 molars, 2 premolars or bicuspids, 1 canine, and then 2 incisors per quadrant. When you look at a canine, and don't get confused with the tooth canine because, you know, it's easy to do. They have generally have, and a lot of this depends on the breed, the size of the dog, 2 molars, 4 premolars, a canine, and then the 3 incisors at the front. And then cats or felines usually have just 1 molar, 3 premolars, a canine, and then the 3 incisors. And again, it varies a lot depending on the breed and the size of the dog. So as we break these down, a lot of the differences have to do with what each animal eats and how they developed and what the ancestry was. When you look at, for example, the incisors are typically the component that we use to bite into food. That's the function. That's why they're smaller, and they're pretty consistent between the 3. The canines have a completely different function. So the canines are really used for tearing apart food. They're the sharpest teeth in the mouth. So when you look at the diet of humans compared to dogs, for example, dogs are descendants of wolves, and their diet consists mostly of carnivorous meals. They tear meat apart. That's why their canines are so pronounced and sharp. Humans, we're omnivores, so we've kind of progressed from, you know, tearing into food to grains and different types of wheats that you actually need to grind, and that's the purpose of the molars and the premolars, as we'll talk about. The premolars, like I was saying, they share similar functionality and purposes as our molars. They're used for tearing and crushing food, so they're kind of like a hybrid between a molar and a canine, which is kind of interesting. But they generally have a flat chewing surface that allows kind of the gnashing of food together. And then we have our molars. So I kind of alluded to it before, but our molars are the largest teeth that we have. They're very similar to premolars, but they're larger, and they don't really have as sharp as of cusps, which is the kind of little peaks on the teeth that are used to actually bite into the food. So they're used to grind and crush food. That's kind of like the omnivore portion of the teeth and kind of what the purpose of those are. So when you look at the premolars and molars of animals, or some of our other mammals like cats and dogs, they have very, very sharp molars and premolars. Again, kind of going in line with the type of food that they usually eat. So when we actually look at the joints, the actual joint where the bottom jaw and the skull kind of come together, there's a lot of differences. So humans have something called a ginglymo-arthroidal joint, and what that means, it's a very unique joint when you look at a lot of other animals, in that it allows our jaw to kind of move side to side and forward and back, as well as open and close. And that movement is what gives us such a vast array of food mastication that we can eat, basically. So plant materials require more like grinding and crushing, and it's those side movements that actually allow for that. When we look at dogs and cats, it's their lateral movement, so their ability to move their jaw from side to side is extremely limited. Please don't try this on your animals. I'm begging you. But if you actually look at their jaws and they eat, they kind of like, they open and close like this. They just kind of gnash their food. They don't like move it side to side and grind away. And that's because their jaw joint, the actual joint that articulates the skull and the mandible, is what's called a hinge joint. It just is exactly what it sounds like. It just hinges open and closed. So there's a lot of different conditions that are kind of parallel with the conditions that humans can experience in the oral cavity, and specifically the teeth. So some are more common in dogs and cats than they are in humans, and vice versa. Probably one of the number one conditions that will afflict a lot of pets is periodontal disease. Tooth decay is extremely rare. Trauma, broken teeth, pretty common, and we'll go over some different ways and different treat options and habits that you can instill with your animals to hopefully prevent that. Tooth resorption is another big one. Retained and impacted teeth with some smaller breeds is common. Gingival hyperplasia, which is different than periodontal disease in a way, which is just kind of the overgrowth of the gums, very common in certain breeds, and then halitosis, which is bad breath. So periodontal disease, if you look from left to right here, periodontal disease is gum disease that's kind of spread to the bone, leading to bone resorption. It's usually a result of kind of plaque and tartar buildup on the teeth that is not cleaned away and stays over a period of time, causes a chronic inflammatory response, leading to activation of the cells in the bone that kind of eat away at the bone, called osteoclasts. And unfortunately, once gingivitis, which is a gum disease that doesn't affect the bone, progresses to periodontal disease, it's irreversible. We can't grow back bone easy in that situation. So this is an example of what the healthy gingiva would look like on a dog. So nice and pink. When we look at the margins of where the teeth and the gums come together, they're nice. There's no band of redness. And if you were to brush these particular teeth here, you wouldn't expect them to bleed. Bleeding when you're brushing your teeth or your dog's teeth is an indication of active periodontal disease. This is what a kind of more mild presentation of periodontal disease. If all of you have dogs and go look in their mouth right now and you're not regularly brushing their teeth, or they haven't had a professional cleaning in a while, this is likely what you're going to see. And you'll see this kind of uniform red band of inflamed gum tissue kind of around the teeth here. And then this is a more advanced progression of periodontal disease, to the point where it starts to actually affect how much support the tooth has within the bone. This can be pretty uncomfortable. It's probably as uncomfortable as it looks. So the pathophysiology of periodontal disease, again, is the inflammation and destruction of the periodontum, which is the support of the tooth within the bone. It's triggered by bacterial plaque accumulation around the teeth that's left there for a long period of time, and your body natural reaction to that leads down the road to bone loss. And then effectively the support of the tooth within the bone goes away, and that's what leads to a lot of tooth extraction in dogs and humans as a result. The incidence is really, really high. The the treatment is usually a combination of things. So it's more or less removing that irritant from the area, and a good amount of that can be done with brushing and flossing. That'll get away kind of the soft, kind of squishy plaque that's on your teeth. But once it actually gets calcified into something called calculus or tartar, that can't be removed with a toothbrush. And that's why, you know, humans and dogs and cats are recommended to have professional cleanings. And we'll go into what a professional cleaning is and why that's different than brushing your teeth. Tooth decay is pretty uncommon. You know, if you've ever watched any kind of Discovery Channel documentary or documentary on early humans, and you know, they'll show a picture of a human skull from, you know, tens of thousands of years ago, and the teeth are perfectly straight and there's no tooth loss, and you're like, what happened? A lot of that has to do with our diet change, processed sugars. That's been kind of the bane of humanity's existence, honestly, in terms of dentition. And so when you look at dogs, usually, unless you're feeding your dog a lot of table scraps, you know, dog food is not going to have like a lot of sugar, a lot of carbohydrates that would actually feed bacteria that cause cavities. So, you know, cavities or caries, which is the technical term, is basically the processing of sugars by the bacteria, and the byproduct of that reaction is acid, and that's what kind of demineralizes or eats away at the tooth and causes cavities. So it's pretty rare that you'll see this in dogs. My dogs might have one because I give them a lot of table scraps, but I'm getting better. I kind of got ahead of myself here. So again, pretty rare in dogs and cats. The management, it really depends on how extensive it is. Unfortunately, with animals and the compliance of taking them to the vet and getting oral checks and getting cleanings, that usually gets caught at a pretty late stage where it's eaten away at so much of the tooth that it requires the tooth to be removed or requires a root canal. Trauma. So these are, we'll go through a couple different scenarios here, but broken teeth, oftentimes the canines, unfortunately. A lot of times it's due to parafunction, which is them using their teeth for something they're probably not supposed to, or using it on something they're probably not supposed to, like certain hard treats, like, and we'll go over some of them, like cow horns, deer antlers, stuff like that you can get from the store. These are kind of the early signs of teeth that are under a lot of functional stress. These are called craze lines. They're just little stress fractures that are starting to start on the teeth. Might be kind of difficult to notice if you're trying to check on your dog's teeth. This is an uncomplicated tooth fracture where the pulp, you can kind of see a little pink dot here, hasn't been exposed yet. So this is like a complete break of the tooth. That's a more mild case, again, an uncomplicated fracture. And then we get to the point where there's a complicated fracture, where the pulp of the tooth gets exposed. It's very painful. This is kind of a hypertrophic response which is just like a exacerbation of the pulp tissue to get kind of bigger and inflamed. It'll start to come out of the tooth. And at this point, usually the pain actually kind of goes away at this point. But just because the pain goes away doesn't mean it doesn't need to be taken care of, because usually this is leading to bacterial invasion. The mouth has tons of bacteria. It's a really dirty place, getting into what is supposed to be a sterile environment, which is the pulp of the teeth all the way down to the periradicular, or the area around the roots of the teeth within the bone. And that leads to abscess, and that's where you can run into some life-threatening situations. So this is why it's so critical to you know, always try to take a peek. And you know, dogs can't and cats can't. Sorry, I keep saying dogs. I have dogs, I don't have cats. I want a cat, but my wife won't let me get one. But I'm sorry if I keep saying dogs. But dogs and cats, a lot of what I'm going to tell you, other than the anatomy, has to do with both. But that's why it's critical for us to kind of make sure that we're monitoring that and checking on that every now and then, because they can't talk to us. And so, like I was saying before, you know, a lot of the treatment options will depend on how extensive it is. If it's a little chip on the top and it hasn't gone down to the nerve of the tooth, we can probably get away with, maybe polishing down the sharp spot or putting a filling on there. Obviously, the most important thing is to treat the underlying cause. Why did the tooth fracture? Is it because he or she is chewing on something they're not supposed to? So treatment is going to be kind of futile if we don't figure out, why it is they're breaking their teeth. Um, so that can be anywhere from a filling all the way to root canal treatment if the pulp gets exposed, or extraction if the tooth is fractured below the bone level. So attrition is a related condition to tooth fracture, and it's a type of wear on the teeth that is usually because the teeth are being used to bite into something that isn't good for them, essentially. So hard treats or certain toys like tennis balls are one big thing. They're very, very abrasive and can wear down the teeth over time. Animals that are kept in cages for a long period of time will start to kind of chew at the wire fencing. That's another thing that's seen pretty often, and wear down those front teeth to the point where they're kind of all the way to the gum line, which is not good. And along with attrition is another condition called abrasion, which they're very, very related. So abrasion is when the teeth are wearing against an external object, something that's not natural. And then attrition is when you're wearing the tooth down because of another tooth. So with animals, attrition is likely going to happen as a result of what's called malocclusion, or the teeth not lining up correctly. Abrasion will be from chewing on, things that are a little too abrasive for teeth, and it starts to wear away the enamel of the teeth, and yeah, not good. So, my dog for some reason just loves chewing on rocks. I don't know what it is, but that would be a type of abrasion, which could definitely lead to fracture, absolutely. The management, again, will depend on a lot of things, but you really want to figure out the etiology, and then restoration of tooth will depend on how extensive. So tooth resorption is basically it's a type of inflammatory response, is the body's response to trauma or infection, or sometimes it's spontaneous. A lot of times it could be from a viral infection, which is what we see with cats a lot of the time. And so what it basically is the body eating away at the tooth. And it'll usually require an x-ray to be able to visualize that. But there are some hallmark signs that you can see in the mouth. You can start to see kind of a translucency to the tooth. The tooth will kind of almost look pink. And like I said, a lot of times this is pretty common in felines. There's a condition called feline odontoclastic resorptive lesions, and it generally will lead to loss of the tooth, especially considering that it's usually not detected until it's pretty further down the line. So as I was saying, the tooth resorption, the etiology is really not 100% clear. It's definitely multifactorial. There's nutritional deficiencies can be involved, different local irritants, bacteria. There's a couple of viruses that are known to be big causes, different metabolic imbalances, and a lot of it will depend on breed as well. The clinical management, I know I keep saying this, but a lot of it has to do with at the stage it's at. But unfortunately, with animals, it's only discovered kind of later on in the later stages, and it usually requires tooth extraction. The next condition that is seen fairly often in animals and humans is retained baby teeth or deciduous teeth, and impacted teeth. The reason why these are on the same slide is they go hand in hand a lot of the time. Usually it's the insufficient eruption of the permanent tooth that allows the baby tooth to stay there. So if the path of eruption is not proper, it's not going to push the baby tooth out or initiate the resorption of the apical portion or the root end of the tooth, so that it falls out. So a lot of the time, with puppies especially, if you see kind of a double canine like this, don't be too alarmed. But if you're getting your animals spayed and neutered, this is the time that they'll usually extract those. It's pretty straightforward. They just kind of take them out at that point because they're already sedated. Otherwise, you do have to have them actually under general anesthesia to get those removed otherwise. So again, failure of the primary teeth to exfoliate. Exfoliate just means kind of fall out of the mouth, just a fancier term for it. If they don't come out, that leads to crowding, misalignment like we saw in the photo previously. That can lead to bone loss if it's not taken care of over time. Essentially you'll get plaque buildup there, and it's hard to clean even if you're a human. So that's why we like to get those out sooner than later, in the kind of earlier stages. Malocclusion, again, that's just kind of a fancy term for when your teeth aren't straight and they're not coming together like they're supposed to. Your teeth have a certain orientation that they're supposed to come into for proper function and proper aesthetics. So this is kind of an extreme example here, a little bit of an overbite. And then with dogs in particular, they can't manipulate their jaw in a way where they can avoid traumatic occlusion, which is where the teeth come together in a harmful way. And so you can lead to things like this, where the opposing canine can actually perforate the gums or the roof of the mouth or the other arch, and it can be painful and really, really lead to infection and a lot of other bad stuff. Again, the actual etiology of this is generally related to genetics. There's a huge portion of it that is related to the breed. If it's kind of one of the flat-faced dogs like pugs or Pekingeses and stuff like that, they're very, very prone to having malocclusion issues. Boxers and smaller dogs as well. And so it's a common thing for breeders to have to kind of take into consideration. In terms of therapeutic approaches, a lot of it is, if it's your pet, you're looking at extracting teeth that are causing issues. If the teeth are impacted and they're not causing a problem, a lot of the time we'll just leave them alone. And then there's, there are orthodontic corrections, believe it or not, for pets. I've never seen it done, but you can get appliances on teeth to kind of move them into the correct places with dogs too. But whether or not you want to subject your animal to that and have to, be put under general anesthesia for adjustments, it might not be worth it. And then halitosis. I found this photo, I thought it was really funny. It's obviously the dog's only, it's probably outside in the cold or something like that, but the visual of halitosis just kind of made me laugh a little bit. Halitosis is bad breath, and a lot of it consists of just poor oral hygiene, honestly, especially with dogs. And so if you're not keeping up with the brushing and flossing, and they're not getting regular professional cleanings, they are going to get halitosis. It's inevitable. It's odor-causing bacteria in the mouth. However, if you are brushing your dog's teeth and you still smell it, it could be an indication of something a little bit more insidious, like a metabolic disorder or gastrointestinal disease. And so you might want to, you should definitely bring your dog in and get checked by a veterinarian. But a majority of the time, just regular oral hygiene is going to help prevent that. Again, routine dental prophylaxis, dietary modifications. If you're feeding your dog certain kinds of food, in consultation with your veterinarian, sometimes change the food up can kind of help with that as well. And so that concludes kind of our summary of the more common. It's not all inclusive. There's a lot of disorders we didn't cover that are a little bit more rare, a lot of couple different cancers, salivary gland issues that are a little bit more rare, but those are the general big ones to take a look at as it pertains to our dogs and cats. The biggest thing is poor oral hygiene. It does more than just cause halitosis and make your gums bleed and your teeth loose. There's a lot of research that's classic literature that's been published for a long time showing the implications of how intraoral bacteria can lead to or exacerbate certain systemic diseases. There's a huge connection between periodontal disease and endocarditis, and as well as exacerbating certain disorders of the kidney and the liver. It goes the exact same with animals. It's very, very similar, and it's a leading cause for heart disease in animals in particular. So if the bad breath isn't a big enough motivation for you to brush your dog's teeth, this is a pretty good one in and of itself. And so daily oral hygiene, this is going to be the solution. That's this is the stuff that I'm really hoping to drive home to you today, is just giving you some tips on what products I like to use, what I find works, what happens if you have a puppy versus an adult dog that you've never brushed their teeth. I'll go over some tips and tricks because my dogs definitely they're not huge fans of teeth brushing, but I'll show you. Well, I have a little dog. You'll see in my videos that I have coming up here. So in general, you want to make sure that you're using a pet designated brush and floss, or not brush and floss. If you can floss your dog's teeth, that'd be great. But if you do, send me a video. I'd love to put that in my slides. But brushing and the actual toothpaste that you use, it needs to be animal specific. And the biggest thing is it's the mechanical removal of that plaque from the tooth. That's the big issue. Because if it gets left on there, it calcifies into tartar, and then you're definitely not getting it off with a toothbrush. And it's just kind of exacerbates until you can get them in for a professional cleaning, which a lot of times it's annually, but a lot of people aren't doing it annually. So toothbrushes, I'll show you a few. There's different designs, different methodologies. Toothpaste, you do not want to use human toothpaste. Please do not use human toothpaste. Fluoride within the toothpaste is excellent at remineralizing demineralized teeth, stronger than they were before, but the only difference is humans can spit it out. Pets, they don't spit it out. They consume it in large enough quantities it can make them sick. So please don't use human toothpaste. The biggest thing is with them is that they're not getting cavities. They don't really need the fluoride as much as a species that has a high carbohydrate diet does. So it's the mechanical removal of the plaque. Even if you don't have toothpaste, just taking a wet rag and just cleaning off their teeth is better than nothing, honestly. And they have all kinds of nasty flavors like poultry and fish, and yeah, I don't know how they test all that, honestly. And then there's some dental wipes that are, if your dog is just absolutely non-compliant with any kind of like little plastic thing in their mouth, and this might be a better option. Water additives, there's some diluted 0.12% chlorhexidine rinses specifically for dogs. You can put in their water. It'll help reduce the bacterial load and kind of keep their gums healthy. These are some examples of toothbrush designs. See, we have a little finger brush, pretty self-explanatory. It's oftentimes a little bit easier to maneuver between your lips and pulling their cheek out with your finger. Again, another disclaimer: you consult with your veterinarian first if your dogs, especially if they've never had their teeth brushed before. You don't want to get bit. My Maltese bites me every now and then, but she's smaller and only does a little bit of minimal damage to me. And then they have these little toothbrushes here that are smaller, especially for smaller breeds, can be helpful. This is the one I use. And then they have these ones. I haven't found a lot of success with these multi-surface ones. So there's basically like 4 different brush areas, and it's supposed to fully kind of cover the tooth and brush it away. I've just not found those to be very effective. And then the toothpaste you want to get it's an enzymatic toothpaste. It's different than human toothpaste. So like I said before, do not use human toothpaste. You need to use the specific enzymatic toothpaste. It has two enzymes, glucose oxidase and lactoperoxidase, that actually are bactericidal and actually kill the bacteria and help improve kind of the odors as well and neutralize those as well. And there's an example of the water additive, chlorhexidine, that you can put in their drinking water. So the best way to really start brushing your dog's teeth is to start when they're a puppy or a kitten, where you can kind of get them used to the act of toothbrushing in that initial training stage. So if you can, that's the best time to start. And you usually want to kind of see, regardless, the approach is the same with younger dogs and older dogs. You want to acclimate them first if they've never had it before. So, the first thing you want to do, as long as your dog is friendly and doesn't bite you, hopefully your dog doesn't bite you. But you just want to put your hands and your fingers near their mouth. You want to kind of touch the areas when they're a puppy, get them used to that, so they're not surprised and they're not resistant to it as they get older. It's the same thing with human babies too. You want to get them used to you kind of touching and being around their mouth, so that you can effectively brush your teeth when it's time for that. Same thing with kind of younger animals as well. And then you want to move on from there. Take a little bit of the enzymatic toothpaste on your finger, let them kind of sniff it, lick it. Maybe not brush that day. You're not going to be like you're not going to start brushing and then start brushing every single day, like right off the bat, unless you're just an amazing dog trainer. It's usually a build-up. And so you want to, like, maybe the first few days, just have them just lick the toothpaste off your fingers, and then move on to the toothbrush, have them lick it off the toothbrush, and then slowly start to introduce that onto their teeth. And then if you've already been kind of touching their teeth, then you're kind of set up to actually start approaching that in a little bit more of an effective manner. So, it's the frequency. You usually want to do it like once a day or at least every other day. The best thing and this kind of goes with all training really, is you want to have positive reinforcement associated with something that's enjoyable, something that they enjoy. So, if they really like going on walks, maybe you brush their teeth right before you take them on a walk. That way they associate that with something positive. Or you can use treats, but make sure they're treats that aren't going to just make things worse, obviously. And one other thing I forgot to mention on the other slide is this is a really good time to kind of tell if there's pain or discomfort, if they react differently when you're brushing a certain type of certain area. That might be an indication that there's something going on, and you should definitely take them to the vet. That's how we found out that my Maltese had a couple teeth that were loose, and they're just known for having bad periodontal disease. And so she would kind of just like wince and kind of try to move away when we brushed like her lower front teeth, and that's kind of what our indication was. With older pets, it's still possible. They're not going to be. It's not going to be as quick to train them. It's the same approach. You just want to be gentle. Let them sniff it, let them kind of get used to it, and then go from there. And so I'm going to kind of show you a couple different methods that I like to use and kind of do some demonstration here. I hope you enjoy seeing my little tiny dogs. So to kind of reflect the cheek back, so I'm just kind of rubbing her gums there, just to kind of get her used to, me being around there. You usually want to take your index finger and your thumb from the back and kind of lift the lip up that way. If the dog's small enough to be in your lap, you just have them sit on your lap away from you. Bigger dog, you want to sit kind of right next to them and do the same thing. And so always kind of incorporating positive reinforcement. So that's, you know, I'm going to have her kind of lick the toothpaste off, kind of get used to it. You see, she's like, I don't know what that is. I know what that means. I'm going to get my teeth brushed right now. But anyways, she's just, you know, getting her used to that. I'm going to kind of show her the toothbrush. Nothing as tasty on there, so she probably doesn't want that. And then once you've done that enough times, then you can move on and actually start putting the brush on their teeth. So a little bit of the enzymatic toothpaste. And then when you brush, you want to brush at a 45-degree angle with the bristles facing the gum line. And kind of go in little circles as much as you can. Easier said than done. She's chewing away at it, which I find is a great method to brush her teeth too, because when they're chewing, they're kind of pushing their teeth along the bristles. The majority of periodontal, when you look at cats and dogs, is almost always on the cheek side of the molars, premolars, and the canine. You know, you'll see in a later video how difficult it is to get those little front teeth in the front without them wiggling around. But you know, if you can at minimum get the part right there where you pull the lip back and it's just like the molars, premolars, and canine, you know, you're going to take care of a majority of where the issue is going to be. And then here's a different method. So I was using a toothbrush before. This is the little finger brush. My dogs in particular don't really care for this. They actually prefer the toothbrush, surprisingly enough. So I'm just pulling the lip back right there. You don't have to wear gloves, but I just wore them just for visual. And then the next method is going to be these little dental wipes that have kind of the same enzymes in the material that the wipes are soaked in. And some of them are just little pads, some of them are little finger like sock looking things. Again, I'm just letting her kind of sniff it and get used to it. You kind of wrap it around your finger and then you just kind of clean the teeth just like that. And again, you know, the enzymes are helpful, but really it's the mechanical removal of plaque that's going to be the most effective. You're going to see her eyeballs. She's not having it. She's done with my videos at this point. So, you know, after brushing, you want to make sure you have positive reinforcement, giving her a little treat there so that she's excited to have her teeth brushed again the next day. And this is my problem child and my Maltese. She's just not happy. But you know, what I find helpful, especially with the molars, is to kind of get the toothbrush in there and kind of pull the cheek back with the back of the toothbrush, and then brush as they close. So these are her little front teeth there. This is the hard part to kind of get. Usually, it requires kind of gently pulling the upper lip back with your index finger. So there's all kinds of different products out there. I mean, I feel like there's more products for animals than there are humans for oral care. There's special food. So I use this particular food formulation. I kind of mix it with my normal kibble. The food specifically that says oral care, the little kibbles have kind of these pores that when they bite down on it, the teeth kind of go in these pores, and it kind of just naturally cleans the teeth a little bit. It's the same concept as what the little dental bones, like the greenies, do. They're just porous surfaces that allow the teeth to kind of go in, and it kind of cleans the plaque off. It is definitely not a substitute for brushing, because at the end of the day, as they're biting into this, they're pushing the plaque into the gum line, really. So it's a nice adjunct. It'll help with their breath, but it does not replace brushing at all. There's certain chew toys, like I said, and dental treats that work in a similar way. So the stuff you want to avoid is the stuff that you probably look at the grocery and you probably already know you probably shouldn't get it for your dog. You do it anyways, like rawhide and bones, like actual animal bones and antlers and cow hooves. They're way too abrasive, way too hard. You know, I know it's tempting to get them because they last longer, and you know, your dog doesn't, you know, eat them in one bite just like the other the other treats, but there's a reason why they last longer is because they're wearing their teeth into it to kind of to chew it down over time. And these regularly lead to fractures and attrition of the teeth. Um, Another one, which is always kind of very surprising to people, is tennis balls. So the actual surface of the tennis ball is very abrasive, and you'll actually see kind of the tongue side of the canine start to get worn down from dogs that, you know, play with actual tennis balls off them. You can get dog versions that are completely safe, you know, that look just like it, but the actual tennis balls that are used for tennis are really abrasive. And then it probably goes without saying, but you know, sticky and sugary food. We probably shouldn't be eating as much either, but especially dogs, it's really important that they aren't eating a ton of that human food. So, and then professional cleanings. This is, you know, where kind of the rubber hits the road at the end of the day. Depending on your breed, depending on the severity of the gingivitis, or if there's even gingivitis or periodontal disease there, it might change the frequency of what your vet suggests for the frequency of cleanings. But generally, like once a year, you know, very similar to humans is what they recommend. And so what a professional cleaning does is it removes that calcified plaque, that tartar. You know, even if you are regularly brushing your own teeth, you know, twice a day, flossing, just the natural mineral buildup in your mouth from the calcium content in your saliva will just naturally create calcifications on the teeth in the form of calculus. And it's usually in a patient, at least on the human side, that regularly maintains their oral hygiene. People will always have a little bit of buildup in the upper posterior on the cheek side, and if you ever notice, it's always rough on the tongue side, on the front incisors on the tongue side. That's where you kind of get buildup, and that's because those two areas are where the salivary glands empty into the mouth. And so it's the same thing with dogs. You know, they get this buildup that even if you're brushing, it needs to be removed professionally. Please don't go on Amazon and buy scalers. I've seen human patients do that and really destroy their gums. Please go see a dentist or a hygienist to have that done. And same thing with dogs and cats. Make sure you're actually taking them into a veterinarian for a professional cleaning so that they can use things like certain scaling instruments and ultrasonic instruments to get that calcified stuff off their teeth. So pre-cleaning, you know, they might do some blood work mostly for the general anesthesia. At this point, they're going to not only do the cleaning, they're going to do the entire oral evaluation, take dental x-rays. If they suggest taking dental x-rays, I promise you it's not a scam. I know everybody's trying to nickel and dime everybody nowadays, but the dental x-rays are really, especially on an animal that can't tell you what's wrong, are oftentimes the only thing that we have to kind of see what's going on underneath the gum line. Because it's kind of like an iceberg. The part of the teeth that you see in the mouth is like a third of what's actually there. And the only way we can see the rest is through x-rays. At this point, and depending on what vet you go to, they'll usually have they'll ask your preference on what you want to do. If they get in there and they see teeth that need to be removed, do you want to authorize it? Do you want them to call you? You know, I generally find that a lot of veterinarians are very conservative, and if they recommend taking a tooth out, it really needs to come out. And so that, you know, anticipate that during the cleaning, that's where a lot of definitive things will happen, like extractions. And then afterwards, sometimes they'll have some dietary modifications depending on what they do, and pain management. They'll usually give you like an NSAID to control the pain afterwards. And this is kind of what the cleaning will look like. You know, they'll use these ultrasonic. This vibrates at a high frequency and kind of chips off the calculus, and then hand scalers kind of getting the little nooks and crannies there. Again, frequency, you know, roughly about once per year. It'll depend on the breed. It'll depend on the pet's age, kind of the status of their dental health. You know, if the oral hygiene is being kept up well, and there is no history of periodontal disease, and the owner's compliant, it might be that once a year, or once every 2 years sometimes. But if the patient essentially has kind of a really quick turnover of buildup, it might be a little bit more frequent, but definitely consult your veterinarian. So a couple different restorative treatments. So just like human teeth, if an animal tooth does get a cavity, the treatment of choice usually is to remove that cavity and then fill it with a filling material, whether it be a amalgam or a metal restoration, which is not as common anymore, or what's called a composite resin, which is the tooth colored filling. And then on top of that, we can also do crowns. So a lot of people don't know this, but if we're doing any kind of full coverage crown for a tooth on an animal, which usually is indicated for extensive breakdown of the tooth, whether it be from a big cavity or a fracture. So if they fracture the tooth off, oftentimes the filling won't hold up and a crown will be indicated. And then if a root canal is done at any point, crowns are usually recommended. So this is a titanium crown. This is the most common material crown used on dogs. Looks kind of cool. There's special labs that handle these. You actually take a mold just like you do on a regular human tooth. You shave the tooth down, put a mold on there, send it off, and have this fabricated, which is kind of cool. So you can see that they're almost always on the canines. And the reason for this, a lot of people might say like, hey, why don't you just extract the teeth? But it's important to remember that these particular teeth, especially on dogs and cats, are critical to them functioning and eating and being able to work oftentimes. So when you look at certain like police and military dogs that are used in the capacity for like combat or for biting or subduing somebody, the military, I know at least, spends $40,000 to $50,000. That's the cost to train one dog, whether it's a German Shepherd or a Malinois. It costs that much to actually train these dogs, and if they fracture a canine off, and their job, their purpose was to be able to bite, it's really important that we get that functionality restored. So that's kind of the purpose of that. So this is one where this poor little guy probably broke all 4 teeth of his canines off, but now he's back on track. It's funny, sometimes you'll see these dogs that actually do have the titanium crowns. The other dogs that are around will kind of like, they'll like look, they'll actually kind of like get up and they'll actually see the kind of the shimmer on the canine, and they become really popular among the other dogs afterwards. It's kind of funny. And the root canal therapy, if any of you have had the pleasure of having a root canal, you kind of know the drill, no pun intended. But usually it's when there's a cavity or a fracture that leads to exposure of the nerve inside the tooth, the pulp. And it's basically a big filling. It's a filling that goes to the end of the root. That's what I like to tell people to make them feel better. So, we remove all that decayed, infected tissue, and then fill it up with a kind of a rubber substance called gutta percha, and it helps prolong the life of the tooth. So this is a little case. This is one of the cases that I did in the military. This was a service member's dog. I did some pro bono work for the the enlisted guys that couldn't afford $2,000 for a root canal for their dog. So I would go do them for free at the on base vet. So he had fractured off this canine here. He was just given a sedative, so that's why he's all loopy here. Before this, he was barking at me. He really was not a fan of me. I think he knew who I was. So this is an X-ray of the tooth. You can kind of see the outline of the canine here. And then if you look at the little gray part here, this is the nerve of the tooth. This is the pulp. And the tooth is fractured, so now the pulp is exposed to the oral cavity, painful, and likely going to lead to an infection. And that is us doing the actual root canal. So we're drilling into the tooth to actually expose the pulp in a way where our instruments can get down and clean everything out more effectively. And so this is after accessing it. You can kind of see we've exposed the canal a little bit better. And then these are our files that are down there, cleaning up all that bad stuff in there. And this is our post-operative x-rays. You can kind of see we've removed all the bad stuff and kind of filled the canal up with that rubber substance, and then put a little filling on there, and now he's good as new. So imaging and diagnostics, this is just kind of reiterating what I was talking about before. You know, you might not see this big infection at the end of the roots here just on the outside surface without the x-rays, and you know, the dog can't tell you that he's or she's in pain or is having any issue. In addition, you can see the mandibular fracture here just from advanced periodontal disease. It's why it's so critical. It makes them more prone to jaw fractures in the event they're playing rough. You know, it's pretty wild. So again, early signs of dental issues, you're going to look, you know, bad breath, it's a big one. Changes in eating habit, they might, you know, stop eating as much, or they might be uncomfortable chewing harder foods. Pawing at their mouth is a big one. You start seeing like visible tartar and plaque buildup, it might be an indication. Red, swollen, bleeding gums. It won't tell you exactly what's wrong, but it'll tell you there's some kind of inflammation there. And obviously loose or missing teeth. You know, if you look careful enough, you can see if the tooth is fractured. And then swelling obviously is going to tell you that there's an issue there. Also, any behavioral changes, irritability, aggression. If they had toys that they absolutely loved and could never put down, all of a sudden they're kind of avoiding it. That might be another issue. And with that, you know, these are some other resources that you can, you know, these are the two authorities when it comes to veterinary dentistry: the American Veterinary Dental College and then the American Veterinary Medical Association. For any more resources on this, obviously the best person to ask would be your veterinarian or a veterinary dental specialist, which is a very, very prestigious and very long road to become a veterinary dental specialist. I mean, they go to training for, they do their 4-year DVM, their doctorate, and then it's 3 to 6 years after that just to become a veterinary dentist, basically. And so they're very, very, there's not a lot of them. There's, you know, probably 1 or 2 or 3 in Nevada alone that I can think of. But they're the ones that will take care of things like, you know, molar root canals or really serious medical issues. Most veterinarians, though, are trained to do extractions and cleanings, and you know, some of them might do fillings and root canals. But you know, if you have a major issue like a mandibular fracture or something, that you're usually going to be referred to a veterinary dental specialist, and they're awesome, very knowledgeable. And then these are my references. And thank you again. I'm sorry I couldn't be here in person with you all, and I'm really looking forward to, you know, speaking again. And you know, I couldn't give the presentation without a plug to our 2 clinics here. We have a dental clinic in Henderson, a dental clinic in Summerlin. Unfortunately, I can't see dogs there, but I can definitely see all of you. So if you're interested in making an appointment, need a dentist, give us a call. That's our phone number down there. Big thanks to Vanessa and her team for putting this together and having me here and accommodating my virtual presentation. And I hope you all enjoy Dr. Chen and Dr. Lasky's presentation and all the awesome stuff that we're doing over at C4K and our collaboration here at Roseman. And if you need to get a hold of me or have any questions, again, probably should ask an actual veterinary dental specialist, but I'll do the best I can to help answer any questions you might have, because I'm obviously not there for a Q&A session. So I appreciate everybody's attention, and I look forward to seeing you all in person at the next one.